If you're like most people with an L4, L5 disc problem, then there's a lot of pain with sitting and standing and sleeping. It's a real problem. And having worked with hundreds of disc patients, myself being one of them, it's extremely frustrating trying to do normal things and then setting that nerve off. These flare-ups that happen, it's because the disc is already overloaded and your nervous system is just waiting to let you know. In this video, I'm going to show you 6 simple resets that you can do right before sitting or standing or laying down. For each position, there's one reset that's designed to calm the nerves, like a nervous system reset, and there's one that's designed to unload the disc. The goal being simple. Let's make sitting, standing, and sleeping tolerable again, minimizing these spikes in pain, minimizing the pressure or load on the disc, so that you can be as comfortable as possible and so your body can actually heal. Remember that these are tools that you'll add to your disc pain relief arsenal, and you'll have to try them and figure out which ones your body responds to the best. And if you'll stay to the end, I'll show you one bonus reset you can do in bed if pain's waking you up at night so that you can calm the nerve quickly and fall back asleep. Hey, I'm Dr. Paul Barnwell, a chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life they want using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so they can live with confidence and purpose. So if you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery being recommended without a real plan, this channel's for you. You deserve clear answers, not quick fixes. In this channel, you'll learn exactly what's happening inside of your body, what helps it to heal, and the information that most people never hear in a routine doctor's appointment. So hit the subscribe button if you want to understand your body better, reclaim your health, and get practical steps so that you can use right away to help you live better. I upload a new video every week. Let's get to it. Okay, so for each position, I'm going to give you 2 types of resets. One is designed to calm the nervous system itself. These are designed to reduce the intensity of the pain signal, which reduces how aggressively the nerve is firing, thus lowering the intensity of the pain that you feel. The other is designed to unload pressure from the L4, L5 disc itself. It's the combination of these 2 strategies that makes this work. With disc issues, the nerves are extremely sensitive to pressure and change. And because muscles are controlled by the nerves, they become protective, making them tighten up or spasm, further making you feel bad, even in normal positions. So these neurological resets prepare your body for reducing nerve guarding and disc pressure before you load the position. This isn't about fixing posture or forcing movement. It's about being as comfortable as possible. So let's start with sitting. Sitting is often the hardest position for people with an L4 or L5 disc bulge. Many of us have to sit for long periods of time to get things done. Sitting removes all the shock absorption that your feet, that your ankles, that your knees and hips are responsible for, leaving that responsibility directly on the discs and the lumbar spine. So if you're sitting down and within, a few minutes, your lower back muscles tighten up and you feel that the pressure is starting to build, and in some cases, pain starts traveling into the legs, these resets may help you. The first is a neurological reset called seated eye movement and breathing reset. This one feels almost too simple, and that's why some people just dismiss it. But slow eye movement combined with belly breathing or diaphragmatic breathing helps to reduce the nervous system stimulation as well as the guarding that your muscles experience. So I'll explain it afterwards, but just try it with me. It'll take you a couple of seconds. If it works for you, great. And if it doesn't, it took you 10 seconds. So all you need to do is make sure that your feet are nice and shoulder width apart. You're sitting upright in your chair. Make sure that your shoulders are nice and relaxed. Your jaw is relaxed. Your head is over your shoulders. Just get in a good, relaxed place. All you're gonna do is take a deep breath through your nose, have a big belly breath, and then you're gonna release it through your mouth slowly. Very simple. That's the breathing part. We're gonna combine it with eye movement. So again, I'll show you why that works afterwards, but just trust me. So you're gonna take the deep breath, but as you do, as you're breathing in, you're gonna move your eyes to the right Try not to move your head, and then you're gonna move your eyes to the left as you breathe out. So breathe in, move them to the right, breathe out, move them to the left, okay? It doesn't matter if you start at the right or start at the left. You can start with whichever one is more comfortable for you. So we're gonna do maybe 3 reps here. So you're gonna take a deep breath in at the same time. I don't know if you can see my eyes or not. And if it helps, you can close your eyes. And we're gonna take a deep belly breath through your nose. Send the eyes to the right. Breathe out slowly. Send in the eyes to the left. It doesn't have to be slow movement necessarily back and forth with the eyes. Too much to focus on. Just make sure you're nice and relaxed. Take a deep breath through the diaphragm, through the nose. Big belly. Send the eyes to the right. Let's do that one more time, okay? After you've done 10 of those, see if anything's changed. See if it's relaxed your body, if it's calmed those muscles. The way that this works, your brainstem and the cerebellar pathways, which is right back here, they regulate muscle tone and your stress response. By doing this exercise, it allows the body to reduce the protective bracing before you load the spine. And if eye movement changes your pain, that doesn't mean that the pain was imaginary. It means that your nervous system was working too hard to protect you. Just to be clear, this isn't gonna fix the disc. It's just making the environment around it less reactive. Okay, so the second reset is a mechanical reset. And this one is about pressure. It's called a seated hip hinge decompression. This one is really not a stretch. It's really not even an exercise. It's just a relaxation type movement. This one's a very, very simple one. So all you're gonna do is get in the same chair that you normally would be in. And I'm gonna turn sideways so you can see me here. So we're gonna be here. And you're gonna be in the same position, so nice and relaxed here. Sit up nice and straight, and you're simply gonna soften the lower spine, meaning you're gonna try and take the tension out of it. You're gonna put your hands on your thighs, and you're gonna allow your arms to take all of the pressure, and you're just gonna sit here, relax, and focus your mind on your back muscles, and just let them relax. You're gonna do this for 30 seconds. Now, if that's not enough, then what you can do is cradle your arms like this. We're gonna put them down right below your belly, and you're gonna lean forward the same way. And just relax on those arms. Same thing, you're gonna do this for 30 seconds. If you want even a little bit more, you can get something like a throw pillow like this. And that's gonna give you a little extra support. Cradle that, tuck it in tight, and just lean forward. And just hold that for 30 seconds. You're just taking pressure off the disc. It's as simple as that. So the next 2 resets are mainly for walking, although you can use them in any of these categories. If you find yourself constantly shifting your weight or leaning this way and that way, just trying to avoid pain, or you're just avoiding standing altogether, you'll want to try these resets next. You know, a lot of my L4, L5 disc patients, oftentimes standing still is worse than walking. The moment you stop walking, the pressure starts to build in your lower back, and your leg starts to ache or burn, and it feels like you just can't find a comfortable position. This is a combination of compression and asymmetry that happens. And when the disc and the nerve are irritated, the nervous system keeps certain muscles overactive, often more on one side than the other. Then as soon as you stand still, that unevenness makes your back and leg symptoms worse. So before standing for any period of time, we need to rebalance the load as much as we can. So the first one is called the cross crawl standing exercise. So for this exercise, please listen. If you have a very hot disc and you've got a lot of symptoms, you may want to forego this one and wait until the next one, which may help you a little bit more. But if you're finding that you're having to stand in one position for a long period of time, or at least long enough that you start to get symptoms in your back or down your leg, this is what you're gonna do. So You're gonna stand nice and tall. You're gonna have your feet slightly wider than shoulder width apart. Now we wanna make sure that, that you're balanced here. So what you're gonna do is shift your weight to one side. You're gonna lift this leg and touch it with the opposite hand. This is not about speed. Now you don't wanna go this slow. I'm just showing you. And then we're gonna shift to this side. We wanna be nice and controlled. We're shifting our weight back and forth, trying to create a level structure, just like this. If you're finding that balance is too difficult here, to make it a little easier, the cross crawl component helps neurologically. But what you can do if the balance is bad is just lift the legs and cross the body with the knee, just like that. So the second reset for standing is mechanical. So this one's about unloading compression. It's a spinal traction unload reset. This is one of my patients' favorites because it feels awesome. I'm gonna show you a few variations and then you can try which one works the best for you given the situation that you find yourself in. Before I do this though, I want you to know that this should be very gentle. Oftentimes it feels good to strongly unload the spine, but then as we bring it back together, you're gonna get strong muscle spasms. So please, please heed my advice and take it very, very light. To start, you wanna find countertop first. I'll show you some other variations here in a second. And what you're gonna do is lean over, try and get your body weight over the countertop. I'm on my tippy toes, I'm not sure if you can see that. And then I'm just gonna gently relax my knees and allow my back to traction. It feels really great. Don't fully release your legs. Again, we want very gentle traction. And then when you come back to standing, you wanna slowly load it back. Okay, be very careful. We don't wanna grab it and cause that spasm. If that feels good, we're gonna do it again. And you wanna do this at least 3 times for 30 seconds each. And if that is uncomfortable or you prefer a different type of traction, you can do it while seated. Again, we want good posture here. You're gonna put your hands down on the chair, get to the edge, and then we're gonna lift up and just try and relax our low back. That's gonna give you a slight traction here as well. 30 seconds, if you can manage it. This one's a little harder because you have to use your arm strength. Lean forward just slightly and allow that back to unload. I'm gonna show you one more that's also really great. This is gonna be the same thing, but it's a little bit different format for people who have a hard time doing the one on a counter or the one in a chair. This might be a better option. So what you wanna do is find something that you can lean up against, like this, okay? And then I would highly suggest something for your knees. You can just use a pillow if you have it. A towel could work as well. And so you're gonna put your waist here, just like this, and you're gonna lean forward. It's the same exact format as what we did on the counter, but you're just gonna do it on the table. So very simple. So hold on to the table itself or the couch or the bed, whatever it is that you're using that works. And then we're gonna traction forward and then allow our low back to just relax. Now, if the surface is too low and it's not working for you, then you can bolster it up with something like a pillow. So we go here. This is gonna be a little bit high for me. And you're gonna lean forward and we're gonna do the same thing. So remember, we don't want this to be too strong. You just want a little bit of traction on the low back and you just wanna relax into it. 30 seconds, it's gonna feel awesome. So again, just pull forward, make sure it's at the hips, and then just relax the low back. That actually feels really awesome. And that's it. Give it a try. Let me know. Let's move to the next one. We're gonna be working on sleeping or laying down. When you're ready to go to bed, this could be a very frustrating thing for people with disc problems. So we're gonna run through 2 different options for you. So one is gonna be a neurological reset and the second one's gonna be mechanical. First thing, make sure that you have a pillow under your legs and you have something small like a towel under your low back. That's gonna take some of the traction, some of the compression off of your your disc. Just like we did with the sitting, we want to make sure that we have deep diaphragmatic belly breathing. This is going to reset your nervous system. It's going to calm all those very tense muscles down, and it's going to help you feel a whole lot better. And then I've got a second one that I'll show you in just a second. So first of all, make sure that we've got a pillow. It's going to go under the knees, and small round pillow or towel that's going to go up under your back. When you're in your position, all you're going to do is take a deep breath through your nose to your belly. And then I want you to think about blowing through a straw. We're going to do that 10 times. I'm not going to make you watch 10 breaths here, but you're going to do that part on your own. One thing I want to make mention of is that as you're blowing out, you don't want to increase any pressure here. That increases load. We want to decrease load. So deep breath through your nose, out through your mouth. After 10 of those, you should be feeling pretty relaxed. And then as soon as you're done with that, we're going to move to the next one, which is the mechanical reset. I'm going to give you two versions of a reset here that I think can help you a lot. Again, remember with all of these, we're not putting a lot of aggression into any of them. They need to be very, very simple. So let me show you the first one, and then I'll show you the slightly more advanced one. So with the first one, you're laying down. You're going to have the pillow, and you're going to have the towel or the small round thing that's under your back. You may not need the one that's under your back at this moment, but you can keep it there if you want. And so what you're going to do is keep your knees shoulder width apart like this, and you're going to just make sure that the weight is on your heels. And essentially what you're going to do is you're going to try and get weight off of your backside, and you're going to shift the weight right up. If you feel where the bottom rib is, that's where you want the weight to go. So you're going to roll up this way, just very slightly, to where you feel the weight go on this part of your back. Now, to give you the difference, we're not doing a hip, we're not doing a glute bridge. We're just shifting, just rolling back up on top of that. Imagine a fold in your stomach right here. And you're going to hold that. Essentially what we're doing is taking pressure back off. You'll notice that's the trend here. We're getting pressure off of the disc. Okay? If you can, another version of this that's combining the traction move with the decompression move, you're going to bring your knees a little bit closer. You're going to take your hands, put them on your hips here, and push down. You'll feel it traction your back. Just that alone may feel better. And then you're going to do the same thing. So you're going to fold up this way, and then keep pressure, and as you come down, you'll feel that unlock that disc. So here, and then push. Don't push too hard, remember that. The goal here is to where you can do this without getting out of bed, because you don't want to get, completely woken up and have to restart this whole process. However, if this doesn't work, you may have to use the other tools in your arsenal by getting up and walking through those steps, so that we can relax that disc enough to where you can get a couple more hours of sleep. These are all helpful. If none of these are working for you, then you may need proper care, and that's what we're here for. So give these a try and tell me which ones you liked the best, which ones you tried and that you feel like they really worked for you. And it really helps if you tell me like what your symptoms are. Sometimes this works with really hot discs, and sometimes it doesn't, just because everyone's got a different situation. You can have an L4, L5 disc bulge, and it might be on one nerve versus another. It might be a central bulge. So when I find out that it's working well for certain types or certain populations of patients, then I can better tailor, tips and tools that I can help you better with. So if you try it, tell me which one it is, because I read every single comment. So I hope this video helps you. If it did, then share it with someone dealing with back or leg pain, or who needs, practical tools that they can actually use during the day. And if you want to understand your body better and learn how to manage pain intelligently instead of guessing, make sure you subscribe. The next video that you should watch is this one, where I walk you through 5 exercises that work especially well for L4 and L5 disc bulge symptoms. Go watch that one next.